Some positive news in the fight against the coronavirus. The pace of COVID vaccinations in the United States is steadily rising. The drug makers have distributed nearly 56 million doses across the United States. Healthcare workers administered more than half of those shots. But as CBS News national correspondent David Begnaud found out, the vaccine rollout is based on population size, leaving several rural areas behind.
Y'all wear your mask and stay safe, okay?
The heart of Appalachia beats with the help of nurse practitioner Teresa Tyson.
How long did you work in the mines?
32 years.
32 years.
She runs the Health Wagon, the mobile medical clinic providing crucial health care to low-income and underserved people here in southwestern Virginia.
They don't have reliable transportation. They don't have the money for fuel to go to a clinic.
For 28 years, Nurse Teresa has navigated these rural roads of Appalachia to service those who otherwise may not get any medical care. What they need now, she says, is the vaccine. The Health Wagon services 2 health districts in the state. Those districts account for about 2% of Virginia's population. And this week, they received about 2,100 doses out of the approximately 120,000 vaccines allocated to the state. Now, that's just under 2%.
How about the COVID vaccine? We are trying to get that.
Health Wagon, which has more than 5,600 active patients, has not gotten a single dose. Instead, they've gone to mostly local hospitals, local health departments, and long-term care facilities.
I'm just desperate to get the vaccine for my people.
We went to Dr. Danny Avula, the state's vaccine coordinator. He told CBS News there is not enough doses coming from the federal government to distribute to everyone who wants it.
A month or 2 months from now, as new vaccines come on the scene, we'll be able to start feeding all of these channels of providers and pharmacies who can get out the vaccine at large scale.
As of today, Virginia is deciding who gets vaccines based on population. But Nurse Teresa says that's not fair. Appalachia is more rural, but the need is enormous.
Vulnerable populations need to be a priority in receiving this vaccine. They have chronic health conditions. They actually live 10 years less than our counterparts on the eastern shore of Virginia.
And they're poorer here. Health Wagon says the poverty rate of the area it services is 54% higher than the rest of Virginia.
Is there something you can do to get vaccines here for them quick?
Absolutely. It's called more doses.
He is Virginia's governor, Ralph Northam, who himself is a doctor.
Right now, David, we're getting about 120,000 doses a week. We need about 350,000.
Most of what I heard is Teresa's doing great work, but she just needs to be patient. What do you say?
Oh my gosh, I can't be patient. I have to be a voice for the people that do not have a voice here. How can you be patient in a pandemic when people are dying?
Here's the bottom line. Virginia needs more doses from the federal government, but so does every other state. In the meantime, what are they going to do to help Health Wagon? Full disclosure, when the governor heard CBS News was coming here, he asked to be a part of the story. And I thought he was going to come on and say, I'm sending doses there. He didn't. But Nurse Teresa remains optimistic. She's got a good relationship with the governor, and she thinks that now that he's on notice, so to speak, he's going to do something to help him. David Begnaud, CBS News, here in Appalachia, in the westernmost part of Virginia.
Joining us now is Dr. Julie Morita. She is the Executive Vice President of the Robert Wood Johnson Foundation and a former member of the Biden Administration Transition Advisory Board. Dr. Morita, welcome. Great to have you with us. So you spoke before a congressional hearing yesterday about vaccine inequity. You also co-authored an article in USA Today that really drove home the point that while the pandemic is affecting everyone, it is not affecting everyone in the same way. With that said, where are states going wrong with vaccine distribution? And what needs to be done to ensure that those who are the most vulnerable get vaccinated at the front of the line?
Hi, Tanya. Thanks for having me again. I think the key thing to keep in mind here is that data serve as the foundation for how we build the programs. The data told us over the past year with the pandemic, that there are certain groups that are more seriously affected. So communities of color actually have higher rates of disease, hospitalization, death. There's also rural communities that are impoverished communities that are actually at higher risk as well. So the data told us who's at risk. And now the key thing is really having information regarding where these people are they getting the vaccines or not, and then directing the resources and then modifying programs to make sure that people can actually get the vaccines, that those who are at highest risk for serious disease, death, or hospitalization are actually able to get the vaccine. So critical to that is making sure the vaccines are located in the right places, either by mobile van or by fixed site locations, but also making sure that the systems for making appointments and for registering are simple enough that everyone has an opportunity to get them fairly.
And Dr. Morita, on Monday, the CDC announced that it has race and ethnicity data for only half of the administered vaccines. How will this data gap sort of impact vaccinating underserved populations, especially Black and Latino communities?
I think the report from the CDC actually demonstrated the data that they have are really incomplete. And in order to really understand who's receiving the vaccines and how effective the programs are, we really have to have much more complete information. So the Robert Wood Johnson Foundation issued some guiding principles for health equity, for response and also for recovering. And among them were really having granular data that included race, ethnicity, geography, so that we can actually make sure that the information that we have really can help us to fix our programs and make them stronger and allow them to reach the people who are at greatest need.
So moving beyond just the vaccinations, we see now that many places are beginning to ease some of their COVID restrictions, even though Dr. Anthony Fauci has said that at least 70% of the U.S. population needs to be vaccinated before we can return to normal. What do we need to do to get there? And how can we try to manage COVID if some communities are easing restrictions and obviously not all?
So I think we know that there are certain things that actually work effectively to prevent infections in addition to the vaccines. Vaccines are a tool, but we have other tools that we can use. And those things including wearing masks, social distancing, avoiding crowds, washing hands, all those things are really critical. And so doing those measures while we're waiting to get vaccinated, because we know the vaccine supply is insufficient to vaccinate everyone, is really, really important. When community levels of disease transmission are lower, it's okay to open up restaurants. It's actually okay to open up schools, but they have to be done in safe ways so that there's limits in terms of the number of people that are indoor dining, that there's appropriate ventilation, that people are wearing masks when they should be wearing masks, and that those kinds of provisions have to be in place so that if we think about reopening some of the schools, some of the restaurants, that those kinds of measures are in place and can be done safely.
Now, we are seeing more variants popping up in the U.S., but as we reported yesterday, the nation is only sequencing right now fewer than 1% of new COVID samples. And when you compare that to the U.K., which samples around 10% of tests, that seems woefully inadequate. So why aren't we sampling more tests, and how would more sequencing help us in the fight against the virus?
I think it's important to recognize that with this pandemic response, this is the biggest public health emergency that we've had in our lifetimes. And in order for us to have the strongest, best response, we really need sufficient resources. There were billions of dollars that were invested in the development of the new vaccines. And as a result, we have vaccines available at record speed. But what also needs to be supported is the laboratories to do this kind of disease testing, variant testing and identification, and also surveillance. In addition to that, we need additional resources to make sure that those are the front lines, like the mobile unit driver that you were describing, have the resources they need to actually deliver the vaccines to the communities throughout the nation, especially those who are at highest risk and more vulnerable. So really, these additional resources are necessary to make sure that we can actually stand up appropriate response, and that applies to the variant testing as well.
All right. Well, Dr. Julie Morita, thank you so much for joining us. We appreciate your time.
Thank you.